Have you noticed how time seems to accelerate after 50? It is not just a perception of the mind. The body begins to respond with a different, often unsettling rhythm. Strength does not feel the same as it once did. Breath becomes shorter during activities that used to be effortless. Muscles that were once firm become less responsive, losing their tone. While your mind likely remains as sharp as ever, there is a dangerous trap that many fall into, and it is not the aging process itself. The real enemy is acceptance. It is the silent resignation, the belief that frailty is an inevitable part of the calendar turning, and that there is no way around it. I am here to tell you, with the full weight of medical understanding, that this is incorrect. We can stimulate the body to repair and strengthen itself using just a few fundamental movements that require no equipment and are adaptable to any clinical condition, even for those who have been sedentary for decades. Today, I will not only explain the physiology behind these movements, but also teach you how to adapt them to your specific physiology, ensuring you can implement a safe weekly routine. Before we proceed to the clinical application, please take a moment to leave a comment below telling me your name and the city you are watching from. We read every single comment to better understand our community. If you find value in this medical perspective, please like, share, and subscribe if this is your first time joining us. Let us begin with the upper body, specifically targeting the chest, triceps, and shoulder complex. In the medical community, we often look at functional patterns rather than isolated muscles, and few movements in the history of physical training possess the functional utility of the push-up. While you might view this as a common gym exercise, medically, it is a survival movement. It replicates the exact biomechanical leverage required to push a heavy object, stabilize yourself against a force, or, most importantly, lift your own body weight off the ground after a fall. The push-up engages the anterior chain of the upper body, but, crucially, it also demands significant activation of the core musculature to stabilize the lumbar spine. A strong core translates to better posture and reduced back pain, which are common complaints in geriatric medicine. However, the traditional form can be biomechanically impossible for an untrained shoulder girdle. So we must apply the principle of leverage to make it safe. For those starting or resuming activity after 50, we rarely begin on the floor. We start with wall push-ups. By standing an arm's length from a wall and pressing forward, you activate the correct neuromuscular pathways without placing the full load of gravity on the glenohumeral joint of the shoulder. This promotes the flow of synovial fluid, the joint's natural lubricant, without the risk of injury. As your connective tissue strengthens, you decrease the angle by using a table or stable counter. The lower the surface, the higher the percentage of body weight you are lifting. Eventually, you may progress to the floor with knees supported, which shortens the lever arm and reduces torque on the lower back. Regardless of the variation, the biomechanics must be precise to prevent rotator cuff impingement. Your body must remain a rigid lever, straight from head to heels or knees. Your elbows should not flare out to 90 degrees. Keep them tucked at a 45-degree angle to the torso. This simple adjustment shifts the load from the delicate shoulder joint to the stronger pectoral muscles. Breathing is equally vital for blood pressure management during exertion. Inhale as you lower yourself, controlling the negative phase, and exhale forcefully as you push away. Do not rush, as controlled tension signals the body to reinforce bone and tendon strength. Once we have addressed the upper body, we must turn our attention to the foundation of human independence, which is the lower body. If there is a single movement that directly correlates with a patient's ability to live autonomously, it is the squat. Every time you sit in a chair, use the toilet, or lower yourself to a sofa, you are performing a squat. When we see patients lose this ability, it often marks the beginning of a dependency on caregivers. Biologically, the squat recruits the largest muscle groups in the human body, specifically the quadriceps, hamstrings, and the gluteal complex. Engaging these massive muscle groups simultaneously creates a potent metabolic demand, which is essential for regulating insulin sensitivity and managing body composition. Furthermore, and perhaps most critically for the aging population, the compressive force of a squat stimulates osteoblasts, the cells responsible for building new bone tissue. This is a primary defense against osteoporosis and fractures. Additionally, the intense muscle contraction stimulates the endocrine system to release maintenance hormones that combat sarcopenia, the age-related muscle wasting that leads to frailty. Just as with the upper body, we must approach the squat with a respect for your current orthopedic condition. If you have not exercised in years, we begin with the assisted squat. Using a sturdy chair or countertop for balance removes the fear of falling and allows you to focus on the neural connection to the muscles. The motion must be deliberate. As you descend, you are not merely bending your knees. You are folding at the hips, pushing the pelvis backward as if reaching for a chair behind you. This hip hinge mechanism is vital because it offloads stress from the patellar tendon in the knee and engages the powerful glute muscles which protect the lower back. For those with significant knee pathology, we utilize the partial squat, descending only a few inches to a pain-free range. This still activates the quadriceps and stimulates blood flow without grinding the joint surfaces. Proper alignment is non-negotiable for joint preservation. Your feet should be shoulder-width apart, with toes turned slightly outward to accommodate the natural anatomy of the hip socket. As you descend, your knees must track directly over your toes. They should never collapse inward. That inward collapse, known as valgus stress, is a leading cause of ligament strain. If you find your heels lifting off the ground, it indicates tightness in the Achilles tendon and limited ankle mobility. In a clinical setting, we might place a small lift under the heels temporarily while working on flexibility, but the goal is always a flat-footed stance for maximum stability. Breathing mechanics here are distinct. You inhale deeply into the abdomen before descending to create intra-abdominal pressure that splints the spine, and you exhale on the exertion of standing up. For beginners, the goal is not exhaustion, but neuromuscular re-education. We aim for sets of 10 to 15 repetitions, allowing the heart rate to settle completely between efforts. This is not just about muscle. It is about teaching the nervous system that these movements are safe and necessary. We have addressed the pushing muscles of the upper body and the driving muscles of the legs. But to fully integrate these systems, we must strengthen the bridge that connects them. This brings us to the core, specifically through the practice of planks. When I refer to the core in a medical context, I am not talking about the aesthetic six-pack muscles on the surface. I am referring to the deep, stabilizing cylinder of musculature, primarily the transverse abdominis, the pelvic floor, and the multifidus muscles along the spine. These muscles act as a natural corset. With age, these deep stabilizers tend to atrophy, which directly contributes to the prevalence of chronic lower back pain, balance disorders, and even issues like urinary incontinence. The plank is an isometric exercise, meaning it generates tension without movement. This is particularly therapeutic because it teaches the body to resist harmful forces and stabilize the vertebrae in a neutral position, which is the key to long-term spinal health. The standard plank involves supporting the body on the forearms and toes, creating a rigid line parallel to the floor. However, holding this position requires a baseline of strength that many older adults initially lack. Therefore, we adapt. We can perform a plank standing against a wall, leaning into a table or on the floor, with knees acting as the pivot point. The critical factor is not the difficulty of the variation, but the quality of the tension. You must actively pull your navel toward your spine and squeeze the glutes. This intentional contraction protects the lumbar discs. A common error we observe is the hips sagging toward the floor, which jams the facet joints of the lower back, or the hips hiking up, which disengages the core. You must maintain a neutral alignment, looking slightly forward to keep the cervical spine and the neck safe. Unlike the other exercises, We measure planks in time, not repetitions. Starting with short, high-quality holds of 10 to 20 seconds is far superior to a sloppy 1-minute hold that compromises your back. To synthesize these three elements into a prescription for health, we must discuss programming. The physiology of an older adult requires a different approach to recovery than that of a younger person. Muscle tissue does not grow during the workout. It grows during the rest period. Therefore, leaving at least 48 hours between sessions targeting the same muscle groups is mandatory to allow for protein synthesis and tissue repair. A sensible routine would be to perform these exercises on Monday, Wednesday, and Friday. On Monday, you might perform 3 sets of push-ups, squats, and planks, focusing on form. Wednesday could involve slightly higher repetitions for the squats and longer holds for the plank to build endurance. Friday could be structured as a circuit, moving from one exercise to the next with minimal rest to gently stimulate the cardiovascular system. On the days in between, active recovery through walking is essential to flush metabolic waste products from the tissues. By adhering to this systematic approach, you are not just exercising, you are applying a calculated medical intervention to halt and reverse the biological clock of your musculoskeletal system.